I was first introduced to this lung flute by the Veterans Hospital in their COPD study. When I use it, especially now this past summer, as we all know how humid it's been, how hot it's been, when I use this, I know I can breathe better. I know it.
COPD is the current term. It's kind of an umbrella term for chronic bronchitis and emphysema, and what it stands for is chronic obstructive pulmonary disease. The major symptoms of COPD are shortness of breath, cough and sputum, and also chest discomfort and chest tightness. So the lung flute was developed and marketed by a company, a Buffalo-based company known as Medical Acoustics. And when patients blow into this device, their sound waves go into the airways, and when they go into the airways, they help mobilize the secretions that we have in the airways. And when they bring them up, they can help patients with their breathing and their quality of life. So the clinical trials for the lung flute were conducted at the VA hospital. We do a lot of varieties of studies in COPD. We designed trials with Medical Acoustics and conducted those trials according to FDA guidance, and helped the lung flute get approved by the Food and Drug Administration for both a diagnostic use for obtaining sputum for diagnostic purposes, as well as for treatment of patients with excess secretions in the airways. So there were several reasons that we went ahead and helped Medical Acoustics in this whole process of developing the lung flute. Firstly, I thought there was an unmet medical need. There's nothing out there to help these patients. We have medications which are known as expectorants and mucolytics, but they're not very effective, and they're not approved for long-term use. So there was again this whole issue of how to treat this aspect of COPD and other people, other diseases also. They have excess secretions, for example, people with bronchiectasis and cystic fibrosis. So I think the first thing that got me into this was the fact that there was an unmet medical need, and there was this device which could meet those needs.
I was a very, very heavy smoker. It has affected my breathing. It's affected my lungs. I keep the lung flute right on my bureau because it's accessible. After I use it, it's like instant automatic relief. It just 5 or 6 times, and that's it. I do actually feel a relief. It works for me.